Now, on the next video in our diabetes series, we'll be talking about the concept of pre-diabetes. Pre-diabetes. Now, just like the name implies, pre is something before something. You get? So if you are pre-diabetic, that means from normal, you are now moving towards diabetes. So it's just like you are halfway to becoming diabetic. You get? So look at pre-diabetes, we get to look at the definition, the characteristics. That's basically what makes someone pre-diabetic. The risk factors will follow, the symptoms will follow, the complications, the diagnosis, and possible treatments of everything. All right. So this pre-diabetes is a condition where the blood glucose levels are higher than normal. Do you understand? But it is not high enough for you to now say this person is diabetic. All right. So it's a warning sign that someone is on the way of developing type 2 diabetes. And what is type 2 diabetes? That's when probably there's insulin but there's resistance, or there's little insulin in circulation. Okay. So you can see it. Don't worry, we get to look at the values. So what is the characteristics? If you do an impaired fasting glucose test, you find out that the person is having about 100 to 125 milligrams per dl. If you do an impaired glucose tolerance test, you find out that the person is having about what? 140 to 190 milligrams per dl. If you do, like, let me try, if you try to find, this one is mostly percentage, right? If you try to find out the percentage for what? Glycated hemoglobin, you find out it's about what? 5.7 to 6.4%. Now, what is glycated hemoglobin? Glycated hemoglobin is a hemoglobin that, because there's too much glucose in the body, now some hemoglobins kind of like link up with this glucose, right? They kind of like attach and all of that. Okay. So what is the risk factors? Risk factors, like things that will make it easier for you to develop a pre-diabetic condition. If your age is 45 years plus, if you have a family history of diabetes, if there's obesity, that's like your BMI, that's basal, that's body mass index, right, is above 30. If your physical inactivity, that means you are physically inactive, you are practicing a sedentary type of lifestyle. The ethnicity, Africans, African Americans, Hispanic, Latino, American Indians are more likely to develop this condition. If you have a history of gestational diabetes, if you have a polycystic ovary syndrome, sleep apnea, hypertension, dyslipidemia, all of that are risk factors for pre-diabetes. What are the symptoms? There's none. Sometimes there's none. That's when it's just starting fresh. All right. But you see later on, you see that all these tests, that's polydipsia, polyuria, you now start seeing that the person is now having some symptoms tilting towards, the person having these symptoms are tilting towards diabetes. That's say that the person is becoming diabetic. You get. So what is a complication? It can lead to type 2 diabetes, it can lead to cardiovascular diseases, it can lead to stroke, it can lead to kidney disease, it can lead to blindness, it can lead to neuropathies, it can lead to what? Amputations. Okay. Diagnosis is, these are the tests you have to do: fasting, plasma glucose, oral glucose tolerance test, hemoglobin, that's glycated hemoglobin, right, test, random plasma glucose test, and all of that. Okay. Treatment is lifestyle changes. Make sure you lose weight, do exercise, become physically active, healthy diet, stress reduction, sleep management, and the rest. Okay. So this is it for what? Pre-diabetes.